Good morning, everybody. My name is Lawrence Sabetta. I'm the Associate Program Director. My name is Lawrence Sabetta. I'm the Associate Program Director for the American Honors Program at Flowvel College in East Texas. I would like to introduce Professor Bradley Mitchell. He is an Associate Professor of Psychology at Ivy Tech Community College, and he is also a consultant behavioral psychologist in the northern Indiana area, working with adults with developmental disabilities. Professor Mitchell's research and academic interests also include behavioral economics and neuroeconomics. I will now hand it over to Professor Mitchell.
Okay, thank you. I don't think I'll need the microphone, and I do pace a lot, so we'll try to stay away from that. Again, my name is Brad Mitchell. I work primarily as a full-time faculty member for Ivy Tech Community College up in northern Indiana. I also work with individuals with developmental disabilities on the side. And one of the things that is both an academic and professional interest for me is the integration of people with developmental disabilities into mainstream America. And specifically, because of my dual role as in academics and clinical work, how these people with different gifts are going to integrate into our traditional college classroom. And a lot of my research has shown that we're on the cusp of seeing a lot more individuals with what we call high functioning autism inside of our classrooms, and even specifically in our honors program. Statistically, in the very small sample size that I have, they are well overrepresented in American honors. They are making up, in the research I've done, upwards of 7 to 8% of the students in our American honors programs, and yet they only make up, depending on what statistics you look at, less than 1% to 1.5% of the population of the United States. Coupled with the fact that you wouldn't expect for people with developmental disabilities to be in the traditional college classroom when we think about developmental disabilities as they've been presented in the past. But autism is a different beast compared to anything else that we've worked with, we've had the pleasure of dealing with, and sometimes the unpleasure of dealing with. So what I'm going to do is I'm just going to show you a little bit about the research that's of the students that we currently have in the spectrum of autism in the college classroom, and then look at some tips and some struggles that we might have with those specific students. Quick disclosure, I have no conflicts of interest with any commercial products in this presentation. There are no commercial products in this presentation. However, if anybody wants to offer me a conflict, I'm open. The amount of pay you get for speaking and the amount of pay you get for conflicts is way different. Let's start out with the basics. What is autism? I have a small group here, and my assumption would be either you just stay in your seat because you're comfy, or you might know a little bit about autism. So the clinical definition of autism and the functional definition of autism made a huge change back in 2015. We went from DSM-4TR to DSM-5. And in the summer of 2015, the world for people with autism changed quite a bit. The biggest change that happened was that you may be familiar with some variants of autism, specifically Asperger's, PDD, NOS, which is pervasive developmental disorder. When the DSM-5 came out, they pretty much took all of those separate diagnoses and just crammed them into one giant autism diagnosis. And for those of you in the college setting, there's probably two groups of people with developmental disabilities that you are the most familiar with. People with Asperger's and people with HFA, which is high-functioning autism. And I work a lot with individuals who are high-functioning who have Asperger's, who used to have Asperger's. And one of the key features of somebody with Asperger's, if you know someone with Asperger's, you know that when they know something, they know it. And there's no change in it. And in the summer of 2015, the American Psychiatric Association asked us to tell people with Asperger's, you no longer have Asperger's. Completely, just for people who work with people with Asperger's, it's like, no, we can't tell them that because you don't have Asperger's anymore. Yes, I do. No, you don't. Yes, you do. It's never going to get through to them. The purpose of this was good intentions, always good intentions. The idea was people with Asperger's, people with autism, traditional autism, tended to get more funding from the government when it came to things like Medicaid waiver. And so the APA came forward and said, well, what if we took everybody, people with Asperger's, people with PDD, and just said they all have autism, and then they'll all get more money for more services. Well, what they failed to understand was politics. And just because you have more people taking from the pot, that doesn't mean the pot gets any bigger. So now everybody just got smaller pieces of the pot. It was kind of a colossal, I'm gonna try to clean this up, cluster issue, and especially in Indiana, where the people that I work with work off what's called Medicaid waiver. And instead of the people with really high needs getting more services, people with low needs getting less services, everybody got the same crappy little package that doesn't really help anybody. So when you hear that there's no such thing as Asperger's anymore, there's no such thing as PDD NOS, yes, structurally there isn't, but functionally there is. We still, as clinicians, as people who work with people with autism, we understand there's a spectrum and not everybody is exactly the same. Okay, so I want to give you a couple of definitions so that I'm not talking into thin air and using words that probably don't make a lot of sense. Working with people, these are all ABA terms, applied behavioral analysis. A target behavior is a behavior that we've identified as something that's maladaptive, something that isn't working for the student in the current environment. Okay, function is a very, very complex concept. To make it simple, it's why the person does what they do. And there's three basic functions to everything you do from when you wake up to when you go to sleep. Either you're trying to access something, you're trying to escape something, or you're trying to feel something. That's it. We can break it down to those three basic things. So it's sensory, I want to feel something. Escape, I don't want to be doing this. Or access or attention, I want something. And so the replacement behavior is the behavior that we try to introduce that is going to satiate the function while also not being socially unacceptable. So it's something that is, it's not just don't do it. It is do this instead and you'll get the same result, okay? And so this is all ABA. And obviously, by learning these three terms, you are not, fully trained in ABA, but you basically got the first 1.5 years of ABA master's program under your belt. If you can understand these three terms, you're good to go. If you can implement them, holy cow, call me because we need you. It's a hard one.
I'm sorry. Can you explain the difference between sensory and feel? That seems very close to me.
Those are just same term. It's one of the three. So sensory and feeling, same thing.
Yeah, that's why. But sensory you had with access.
Access, escape, sensory.
Okay.
I'm sorry, I probably overstepped.
Oh, that's all right. I was just a little confused. Okay, so it's access, escape, and sensory.
Yes.
Okay.
And then you can't. It's convoluted because you can try to access a feeling, you can try to escape a feeling.
Mm-hmm.
Normally, if we're talking about feelings, we're talking about sensory, not emotional. Mm-hmm. Okay. We're talking about lights are too bright in here, and so I'm going to put on sunglasses. The function is it's too bright. I need it to be darker in here. And if that's socially unacceptable, which if I sit up here in sunglasses and do my presentation, that's kind of unacceptable. So the replacement behavior would be I verbally ask somebody to turn the lights down. That's a very simple one. And if they were all that simple, it would be a great world for us. And so when we look at autism, one thing that more people understand than better understand than autism is personality. Most everybody has heard at least of a personality assessment. The most popular one out there is the Myers-Briggs. It gives you that neat little 4-letter acronym that tells you what you are and exactly who you are, and that's a totally different subject to talk about whether or not it's truly a really good assessment. But there's a very high correlation on the Myers-Briggs to ISTJ. ISTJ in the personality assessment is that people with autism tend to be introverted. People tend to be sensing, meaning that whatever comes in, they take it as truth rather than looking into it a little bit more in depth. Thinking over feeling, basically whatever the cognitive piece is, that is the truth. It doesn't matter what you feel about a subject, it's that there's a truth and there's a non-truth. And then judging over perceiving, again, it's a little bit of the same thing where an individual with autism tends to take their own viewpoint of the world and judge people if they don't agree with them. And they're not going to look into it any more deeply than that. They're just looking at it as this is the way the world is. And what I always find interesting is this is kind of they give an archetype to each individual type, and the autism, the ISTJ lines up with Ayn Rand. So anybody here's a little bit political. You know, she is right, you are wrong. Her thought process is correct, yours is incorrect. I think it's pretty good. I'm not saying she has autism or had autism, but I don't get it. So the research that I actually have done recently is looking at college students who fit the spectrum. They have what we call today autism. And we've taken out a certain subsection. Anybody who has a dual diagnosis of an intellectual disability and autism, we've excluded them. Because the behavioral problems of individuals with an intellectual disability is going to be different than somebody with pure autism. So these are individuals who probably, if we still had it, would have the old-fashioned Asperger's or high-functioning autism, okay? The sampling I used, anybody here is big on research, just disregard this whole part. It was really crude sampling. Basically, if you were in the population, you made it in the sample, because I just had so few people to pick from. And then the limitations of the research, probably the biggest one in my opinion, is that these individuals were self-identified. Not that they just woke up one day and said, boom, I have autism, but we didn't verify their diagnosis of autism. We took them at their word. So there could be some outliers in here simply because somebody identified as having autism, they don't actually have it. But out of that population, we got 92 people, or sorry, 95, 3 we had to exclude. And there's some interesting little subcategories. 79 out of the 92 were community college students. 19 were university, 4 were graduate students. 32 identified as online only. I think that's very telling with this population. Almost a third of them were online only because the behavioral issues really wouldn't creep up as much as they would in a face-to-face class. I don't know how many of you teach online, but almost everybody at some point when they're typing responses taps into their inner autism. You know, they are right, you are wrong, and it's like going into, when things get out of control, it's like going into a YouTube comments page where there's really no backing of anybody's, it's just this is the way that I think things are correct. So that's a very overrepresentation. And then 9 of the 95 were identified as American Honor students. So when we look at it that way, we're almost at 10% of the population. Now that's definitely misleading because I use a population that I had access to. And I have access to American Honor students. So that number is well higher than what it would be if I could do a really robust sampling. But we get to see a lot of information about American Honors students by doing that. And so we looked at, after I did the research on who I have as students, I did another survey with faculty members at community colleges who have American Honors programs in them. And asked them a lot of questions. What is their experience with autism? Do they think they could identify somebody with autism in their classroom? Amazingly enough, almost every faculty member that I've talked to believes that they can identify with 100% accuracy somebody with autism in their classroom. Way off. If you can't, there's really no way of doing that unless they self-identify. Because if somebody's not being, if they're not exhibiting target behaviors, you may not say they have autism, but they just may have autism and not be exhibiting target behaviors. But the 3 big things that most faculty told me were students fail to think critically about presented information, students interrupt lectures to argue points with what the student perceives to be as facts, but it's actually an opinion, and students fail to accept other learners' point of view. These are not in any order, and actually if we look, and these are going to be too small to really see, but those bottom 3, the orange being the severity of the responses on a 7-point Likert scale, 7 being this is a very problematic issue, and then the blue being the frequency of responses. The other types of questions that most faculty didn't see a problem with, students' academic skills are below college level, student social skills make it hard for them to work in groups, students' classroom behavior is disruptive. So those 3 that I listed before are what faculty have self-identified as being some of the biggest problems. So hopefully the sound's working here. If anybody here is a fan, yes,
Can you go back a little bit to those three?
to the three?
Yeah.
I'm surprised there was no mention of distraction, easily getting distracted.
That the student gets distracted?
Yes, from what is currently being presented.
I think that probably is embedded in the interruption piece. You know, if a student just completely disengages, that's something completely different. But a lot of times, if a student with autism is going to disengage, and they're into the content area, they're not going to disengage. They're actually going to try to make it line up with their viewpoint. They're going to try to bring the conversation back to what they're interested in.
Some of the distraction may not be verbalized. Maybe, you know,
Tapping.
tapping or looking outside the window, really piercing the look outside the window, looking at something.
Okay.
That has nothing to do with the classroom.
So they have gained attention to something else and
Right.
they've escaped whatever it is. For some reason, they have escaped from the
It's almost as if they are not there, they're somewhere else.
Yeah, and you know, I think that that's a universal. I don't think that's just unique to students with autism. You know, most of my lectures are that 2-hour, 45-minute content, and I take a break around an hour 15, so I know that most of my students are, you know, squirrel, and they're off. But that's not something that we specifically put in. That might be something that we actually put in there and see what kind of response we get. Is the actual disengagement piece. Is that something that people are seeing? Because if you're bringing me that without it being an option, it obviously is part of the problem. So we'll definitely look at that.
You mentioned that you don't think that we are probably identifying these students accurately. I mean, obviously, we're most of us not trained psychologists, so that would make sense. But autistic characteristics are frequently quite noticeable. So what makes you say we're unlikely to have been identifying these correctly?
Because the types of students who are in your college classroom are traditionally people with what was formerly Asperger's or HFA.
Right.
The individuals that I would work with in a clinical capacity who have what we consider traditional autism, you would be able to identify almost 100%. You know, if I brought, I think right now I have like 6 guys I work with. If I brought some of my most symptomatic ones, if I brought P with me, he would be standing up here the entire time rocking uncontrollably. You would be able to identify that.
Right.
Somebody with Asperger's and HFA, probably not going to be able to identify because they're not going to be exhibiting those sensory things as much.
So if we're identifying, we may be identifying the pure autism as opposed to identifying the Asperger. So we also have autistic kids farther up the range.
Yes.
Kids.
Yes. You have. I'm going to say that if you're going to miss an identification, you're going to miss it. My science is. I think it's a type 2 error where you misidentify.
Yeah.
You are going to identify somebody based on behavioral issues or social issues as having autism that actually does not.
Okay.
Because one of the things we'll get to here in a second is if you have autism, you automatically have ADHD. It's a part, it's symptomatic of autism. And a lot of times we're going to look at somebody who looks like they have ADHD, which is what you're talking about, looking off to the sky and disengaging. They may have autism, they may have ADHD, they may be bored.
Yeah.
It's very hard to kind of identify. And really the only way to truly do it is to do, you know, a full psychological where you're looking at the history. Looking, did they have the speech issues growing up to age 2? Did they have failure to reciprocate emotional things? The errors that I tend to see are people saying, you know, a colleague pulled me aside going, hey, I got this kid in front, can you come watching to see if autism because they, you know, need to deal. And I'll watch them like, no, they just don't like math. Put me in front, I'd be the same way. I'd be lost. So it's both type 1 and type 2 errors where we over-identify and we under-identify. Right. And to be perfectly honest, when I get to some of the what to do type things, almost all of them have an asterisk to say, hey, this is just good teaching. This is just good classroom management. If it worked for somebody with autism, it's going to also work for a neurotypical person. So just being mindful that these issues are out there, it helps us all out. Okay. So if we look at this is addressing student interrupts a lecture to argue the point of opinion versus fact. I don't know how many of you have had the pleasure of watching the show Community. Absolutely one of my favorite shows. I was actually watching this before I got into community college, and it wasn't funny. And then I went back and was like, holy cow, this is my life. And this is Abed. Abed is an individual who definitely is portrayed as having Asperger's, which would now be autism. So let's hopefully hear and see that in action. You can see, I'm not getting something. I'm just saying here. Okay. We have no sound, so big lead up or not. Essentially, what happens in this clip, it's about a 3-minute clip, and I do have this flow listed online, so anybody can access it. I'll give you a link afterwards. Essentially, Abed gets into a summer elective class called Who's the Boss? And it's talking about who was the boss on the show, who's the boss. We all, neurotypical people, understand that that is a rhetorical question. It's talking about, the housekeeper is kind of the boss, the mother who's living in the house is kind of the boss, the homeowner is kind of the boss. But what Abed does is he goes through and does a complete mathematical and philosophical conceptualization that takes up the entire chalkboard to prove to the professor that there's one boss and this is the person and he is right. Okay? And the academic person argues, like, I've been studying Who's the Boss, not as a fan, but as an academic for 20 years. I know that there's no one boss, and then at the end you see this huge presentation done by Abed, and the professor basically is like, oh crap, Yeah, you can empirically say in a philosophical debate that this person empirically is the boss. And so in this case, you have somebody who is arguing what appears to be an opinion with the student to the instructor who is purported to be giving facts, and in the end kind of flips it on its head and presents facts to take over the faculty's opinion. And so
I think maybe if you go down to the bottom purple line, I think you might be able to turn the sound on there. Kind of, it's almost happening. I see read on something that looks like maybe
this one,
yeah, but it's also got
it would be giving me a ding there if it was turned on.
yeah.
That's kind of work. Plug into my headphone jack.
Yeah.
It's all yours afterwards. I'll
Yeah,
send you
no,
a link.
that's all right.
I'll send you a link to it. I can pantomime the whole thing, but
Yeah, we want that.
focus on like. That's what we get. That's why. Because the sound is going through here, it's not coming out here. So I don't know the lines. I can talk it out, but it's not working. So
In the shows, he portrayed as having autism, or you just have to guess that?
for the very first episode of the series, he's meeting all new people his freshman year, and one of the gentlemen that he meets says something to the effect of, he's asking question after question after question after question, very autistic tendencies, and he says, I think you need to go talk to somebody about neurological issues you might have. So, I mean, it's from the very first one, that is his shtick. He's very cut and dry. But where sometimes comedy goes a little too far, it's perfect, because he's deadpan on everything. And so he's a very good representation. If I could somehow get a college that would let me do psychology and community, it would be my dream. I'm not too keen on that one.
So that show does, I've never watched it because I assumed it kind of belittled the whole profession and the whole.
It does.
Community college.
30 seconds aside, it does, don't get me wrong, but as a community college faculty, you will sit there and say, yeah, I get it, that does happen, but that's an outsider's perspective. Because we do know there's some wacky things that happen on community college campuses. They also make fun of the fact that they offer 4-year degrees, which most of us don't do, and they can't figure out why they keep offering 4-year degrees at this community college. Definitely worth it. Hulu. Okay, so the other two big topics. College is not about regurgitation of facts, rather it should focus on teaching how to critically think about these facts. This is one of the statements that one of the faculty made about the topic of students fail to think critically about what is being presented. The counter to that is that we have found that most of our students who identify with autism do significantly better in STEM classes than they do in liberal arts classes. with about a 0.4 GPA difference in the two. One of the main reasons we think that is, it was given, I understand what's expected from me in STEM. It is math, it is science, and it is cut and dry, whereas in sociology, philosophy, psychology, religion, there's a lot of that gray area that they don't tend to like. And I don't understand subjective material. I think that's one of the things that we have to be mindful of, is that some people just aren't going to understand what some of our subjective, it could be this or it could be this theories might be. And then I've had a disagreement with a professor where I showed them they were wrong and they would not concede. Sure. I think we've all been there. And because we look at things a little bit differently, I think, as neurotypical individuals look at things from multiple perspectives. They also look at things the way that we've been trained. And so when we're given a different way of looking at something, it can be a little bit off-putting. Students need to not only explore their own ways of thinking, but accept that others might think differently from them. And this correlated with students fail to accept other learners' points of view. This brings up a very interesting cognitive theory called theory of mind. Theory of mind, again, this could be an entire graduate level class, but basically, theory of mind is if I'm having a conversation with you, I can look at you and I know kind of what you're thinking based upon your paraverbals, your nonverbals, and then when you look at me, you kind of know what I'm thinking, and I know what you're thinking, and I know what you think that I think that you're thinking. It's the reason people play poker. Because if we got a group of 10 autistic individuals playing poker, they would just look at their cards and go, no, I don't have the best hand, and throw it away. Whereas if you watch poker on like ESPN, you'll see people look at somebody else and say, okay, well, they're acting like they're strong, but they might actually be weak, and they might be playing possum, and so I need to play possum. And it gets into this theory of mind of I know what you know, what I know, what you know, what I know, what you think. I get lost in this rabbit hole, okay? And somebody who doesn't have a good theory of mind, this just blows them away. So asking somebody with autism or somebody in the spectrum to really be empathic and really think about things from that secondary, putting yourself in somebody else's shoes, is akin to asking me what it was like when my wife gave birth. I can tell you what happened. I can tell you that my hand hurt because she was squeezing it, but I cannot tell you what she felt like. And even if you hook me up to one of those really cool contraptions that simulate, do I really know what it felt like to have that? No, because there's all types of weird things going on. One thing, it would actually, and I usually get shot when I say this, not literally, but if you hook up one of those machines that mimic what it's like to give birth, it's actually going to hurt worse for the male. Okay, because what are we not getting? We're not getting that really cool thing called oxytocin. Oxytocin is where there's no results for me getting hooked up and getting shot. I'm not going to have a baby at the end of this. So when a female is actually having a child, they should be releasing oxytocin, they should be releasing endorphins, and so that should mask some pain. That being said, I don't want to go through either of those situations, so I'll just say, God love females for being able to do that, and males don't do it. So, kind of a lead up to, what the heck can we do? So there's 6 big tips here for working with individuals based upon some of the research and based upon applied behavioral analysis and best practices. Number 1, all individuals with autism implicitly have ADHD, okay? And I mentioned this before. If somebody has a diagnosis of both autism and ADHD, it's basically a psychiatrist giving the justification for a medication, because ADHD is a symptom of autism, okay? So one of the things that people with ADHD struggle with is organizational skills. So a clean syllabus and a clean online course room with hard and fast dates and expectations pays dividends for these individuals, as well as our neurotypical students. This is just a good thing, but when we look at things through the fact that these individuals do have some limitations, there's a better explanation as to why we might want to engage in that behavior. Number 2, be as concrete as possible when it comes to assignments. I am super guilty of this. When I give, in my Psych 101 class, when I give the term paper, I tell them, everybody asks, the number 1 question that every Psych 101 student asks about paper, how long does it have to be? And my response is yes. Because I know, I was a freshman. I know that back in the day when they actually, had to type things and turn in a paper, a 4-page paper turns into a 5-page paper by 12.8 font.
Yeah.
1.7 margins. Okay? Nowadays they turn it in, I hit correct, and your 5-page paper goes down to 4. So I tell my students, I want quality over quantity, and I'll tell them that week 1, week 15, anybody have any questions about the paper? Yeah, how long does it need to be? So if that student keeps asking me, I'm like 5. It has to be 5, and that student will normally turn in 5.
Is there like a minimum word count that you think? That's what I usually try to do, is give them a minimum word count, because I don't think that the paper can be well developed below that.
The paper is a unique paper. It's not a research paper.
Yeah.
It is because I have 92 to 95% of my students who are non-psych majors. So the paper is basically giving one thing that you studied in this 101 class that you can apply in your future career. So it's not research. Basically, I want them, if they have to meet somebody in the hallway, like, oh God, it's Psych 101 next semester, I'm a business student. They can come back with, well, I learned about conditioning and I learned as a manager how to manipulate people. You could probably crank that out about 3 pages, and then what I found is if I tell them 5, I get 2 more pages of fluff. So in a true research paper, when I get up into 200 level courses and when I do 300 and 400 level at other universities, yeah, there's a hard count because it's time to get into the academic mode. In my 101, not so much, but I have started giving them page minimums in the syllabus so that if I get asked, they can refer to that. It's just when it comes to grading, somebody gives me 4 pages of awesome, I'm not going to count on 20%. Or 7 pages of fluff, it doesn't give them any more. Watch and pay attention. You're in the front, you're watching, kind of to your point of if you see somebody starting to go off, figure out. I know that when I'm lecturing, I know that up here, I've only been up here for about 35 minutes, but if you guys were all like, oh man, I would need to change my content, I would need to change what I'm doing. Same thing with a regular college class. If I see an increase in target behaviors or anxiety, especially in my students in the spectrum, they will oftentimes exhibit anxiety behaviors like twitching or rustling the papers. I'll know that they are, I'm on the edge of losing them. I want to be very careful at that point. Number 4, nonverbal communication does not work well. So if anybody here's a speech teacher, just plug your ears for a second. Because I know in speech, you're supposed to be, use your hand gestures, your facial expressions to emote. People with autism, it just does not sink in for them. They could be taught through ABA how to really, when somebody does this, that means they're happy. And so cognitively they get it. They can say that person is happy, but because they don't have theory of mind, they'll never really feel it. However, people with autism are really good with paraverbals, which is the tone, volume, and cadence of your voice. And so if I'm talking like this, I'll say, start talking like this. They understand it immediately. Like he's either mad, or he's stubbed his toe, or something has happened. But they're really good about that. I'm going to try to get this quickly, we're running out of time. Be aware of something called your synesthetes. There's this really cool neurological issue called synesthesia. And synesthesia is essentially being hardwired neurologically to take in sensory input through multiple channels. Okay? So a synesthete might be a visual auditory synesthete in which they are looking at these, we have a lot of blue up here. Well, blue if I had synesthesia, may give me a particular tone in my auditory cortex. What I find to be really interesting is that's the kind of the go-to imagery for the autism speaks people. And that would drive somebody with autism nuts because it's so many colors. It would be like 5 different people screaming at them if they had that particular form of synesthesia. Some people without autism have synesthesia. People who can feel music. So somebody who listens to music and they feel it in their body, all of a sudden they can turn around and play it on the piano immediately. That's usually a form of synesthesia. It's really cool stuff. But you have to remember that for people with autism, it can be overwhelming. We got a few minutes, let me give you the 30-second version. My very first clinical job, I was a school-based interventionist for a alternative school. And one of the teachers there was teaching science, and God love him, he was trying his hardest over the summer before his first year. He went into his classroom, he painted all the walls in his classroom. Started out like this beige color. He did periodic table over here, the Big Bang, all the way up to the solar system over here. It's a middle school with students with behavioral problems. I'm not sure what he was thinking, but he did conception to birth over here. So it's like a giant smiling sperm swimming to an egg and then a baby. But it was all types of colors. I mean, it's just everywhere. And so I kind of poked him aside. I said, you're going to have some trouble with these new autistic. He's like, no, I know how to deal with them. And immediately they got in there and they just had trouble concentrating because it was like people were screaming at them just because of these different colors. So just be mindful of your synesthesia. I know this is bland in here, but this would be kind of a dream for a group of people with autism. And then finally, be careful with the comment. Working with people with autism, I have to check myself constantly because I tend to be relatively sarcastic and try to joke with students while I'm doing a lecture. Sarcasm is the worst thing in the world to try to pull off with somebody with autism. Essentially, think of it this way. Have you ever sent a text message that was somewhat sarcastic and somebody came back thinking you were just a complete jerk? You've ever had that happen, or read a sarcastic message? It's like, wow, this person just, no, I was trying to be sarcastic. Always think that when you're using sarcasm, think that you're texting somebody with autism, because they're not going to get the sarcastic nature of what you're saying. They're basically, if you say, oh, wow, that's a good answer, you must be some kind of genius. They're like, yeah, I am, because they're just not going to get that sarcasm. Finally, many of you have probably seen this on Facebook. I usually end my lectures or presentations about autism with this video of Chris and his dad. Chris was somebody in middle and high school who was basically dismissed as having autism, and he was going to be the guy, one of those guys that put him in an institution. We can't do anything with it. Has anybody seen this video before? It's awesome because I can see so many of the guys I work with in this, because he would fight, he would throw feces, he would not communicate, and basically just through using ABA techniques, he was able to basically go to high school, not mainline, but he was in high school. He communicates. One of the interesting things you'll see is he actually gives his dad a kiss, which that is ABA at its finest. He did not create empathy. He does not have empathy. He's going through the motions of kind of showing empathy, but it's still awesome that normally dad would be afraid he's going to get bit, and he reaches in and gives him a kiss on the forehead. It's amazing when you work with these individuals to see something like that. And probably the first time dad got a kiss from his son was probably when he was 18 or 19. Holy cow, that had to be the greatest feeling ever. Yeah.
So these are great tips for classroom that tailored for the autistic students.
Mm-hmm.
What's been your experience in terms of the rest of the students in the classroom? How do you accommodate them? Yes, sometimes you have one or two students in the class that is autistic, and the rest, as presumably, is not. And when one of those two students goes out and does what they do, you can see the reaction of the rest of the class. How do you deal with that?
Let me rephrase let me see if I'm getting you right. So are you worried about, I'm going to modify what I'm doing in the classroom with these two students, and everybody else is going to someday, because I'm happy to change things?
Right.
The suggestions that I put up here have been ones that are pretty universal. I'm not going to ask you to completely change your lecture experience or your assignment experience because there might be people with autism in your classroom. Just some of these techniques are good for everybody. And if you have somebody who has autism and is being disruptive, like if you had Chris in your classroom, you would never have Chris in your classroom when you watch this. But if you had him in a college setting, you would need to get with somebody to have some kind of accommodation, because he is not going to be successful even with the accommodations you're going to provide for everybody. So yes, if you went in full bang and said, I'm going to treat everybody like they have autism because then everybody will get the benefit. No, it's going to be too much for the neurotypical individuals. It's just not, they're not going to be able to take it. Right.
I have to follow up. We'll have a lot of time. I guess I'm going to.
Yeah.
I know you're out. I just have one quick question. Yeah. If you have a student that clearly has, whether it's autism, Asperger's, whatever, like he said, the other students are noticing it, the other students are uncomfortable, would you ever recommend at some point when that autistic or Asperger's student is out of the room, talking to the rest of the students, explaining to them what the situation is so that they would be more empathetic, more understanding, more cooperative?
As a clinician, I would not. Simply because I always had HIPAA and FERPA in the back of my mind.
If you were able to get past those.
If I could get past those,
with permission
possibly.
of the student.
And I've had one student who approached me and said, I have autism and I know you know this, and so if there's ever a problem, talk to me. I'm like, okay, you are like the ideal autistic student. But you're going to be almost always approached by other students, your neurotypical students, about the problem that they don't identify what the problem is. And they're going to identify it in terms of functional behavior. Like he won't shut up. You know, he won't let me ask a question. He's always commandeering the conversation. At that point, just address it as a behavior. You don't need to address it as, well, that kid has autism, we have to tread lightly. Attack the behavior, not the individual. So, yeah, it's going to be something that's going to be a little more difficult, and unfortunately, that's kind of beyond the scope of this, but I would personally struggle with telling people the reason Bob acts this way is because he has autism.
Or maybe not saying that, but saying we all need to be understanding for
Yeah, we can do that in front of him.
or different.
Yeah.
You know, or whatever.
We need to do this differently. Yes, absolutely. I'm all for it. Just not identifying it.
I want to thank Professor Mitchell for his presentation. We probably get together again during lunch for another break conversation later on and continue our questions. But we are done with our first session. I think we have a short break before we relocate, or if you're going to stay in this room, you can stay here. But again, thank you to Professor Mitchell. And,